Right, so on this episode, I thought I'm going to go into a little bit around what do I see as like kind of the common mistakes that people are using or not doing with acupuncture. And I was wondering where to start with in terms of needle sizes, in terms of, accuracy and stuff. And I think that is all relevant. But I think the first thing to bear in mind is that people just don't use acupuncture enough. And let us explain here, right? I think most people see acupuncture and dry needling as kind of like an add-on, all right? So they're doing, let's say they're a physio, they're a chiropractor, an osteopath, they're a sports massage therapist. So their predominant thing that they're doing is like a hands-on modality, right? So hands-on, I mean, mobilizations, it might be massage techniques, it might be some strengthening work, some education, some advice. And don't get us wrong, that's all relevant, right? That's all stuff that is definitely going to help move the needle for people. Pardon the pun. But what I find is that actually sometimes acupuncture kind of gets thought of as like, well, I'm going to use it if those things don't work. Or I'm going to use it maybe like second or third or fourth session in. But if I were to flip it round and to say, well, is there an argument to say that everybody should have acupuncture and dry needling? And I think there could be, right? And this is something that I've kind of been toying with as an idea for a little while now. But if you think about the evidence base for acupuncture, right? We've got some excellent evidence base, and particularly around like pain, so around like pain intensity, how pain influences and impacts people's activities of daily living and doing the things that they want to do. And so what we find is that when you look at these big studies that have looked at the impact of acupuncture, we're pretty sure that acupuncture positively impacts pain. Now, bear in mind that's what most people are coming in for, certainly in a UK-based clinic. They tend to be coming in for a pain-based problem. It kind of makes sense that, well, maybe we should be doing this with everyone, right? I mean, it's safe. As long as you've had your proper training, you're keeping up to date with your CPD, you've done your safety stuff. It's a very safe intervention. So the adverse events risk profile is really low. It's not something that requires a lot of intensity from you as the therapist, all right? So you've got to find your acupuncture points. You've got to be able to put your acupuncture points in. But really, once that's done, there's not a lot of input that you need to do it. So in terms of a resource, in terms of a time resource, it's not a huge impact as well. And I think it's about a mentality shift. I think it's about people thinking about, let's do acupuncture and dry needling with everybody. And I know this is a bold statement, right? It's not something that I actually did as a full-time clinician, right? It's not everybody that would have acupuncture dry needling, but a lot of them did. And when I think about the evidence base and when I think about what these studies are telling us, these studies are telling us that people, by and large, get benefits after having acupuncture. So what if we were to flip the model, right? What if we were to say, with everybody that comes in, let's give them some sessions of acupuncture. And we're not just doing acupuncture, remember. So we're combining it with our manual therapies. We're combining it with our exercise therapies. We're combining it with our advice. And if we did that, are we more likely to get more outcomes? The better outcomes more frequently? Are we more likely to get more exaggerated and dramatic outcomes? And I'm suspecting yes. I think so. And so I think that has been something that I've started to talk about to people on our courses and our CPD events, on our membership CPD events as well. We've been talking about, well, actually, I think we just need to up the dose. I think we just need to be thinking about everybody gets needled right from the beginning. And then we add in all of these other interventions to support that and really help the longevity. There's a couple of ways that you can do this, right? So first up, you do the kind of segmental approach. So somebody's coming in with, say, shoulder pain, and predominantly this is what you're going to do. If you've got an anterior shoulder problem, you put most of your needles local to the anterior part of the shoulder. All right. So you're thinking about the dermatomes, myotomes. You're thinking about where the area of pain is. Look at the meridians that go over that area. Then what acupuncture points are on that meridian local to the area. And that's where most of your acupuncture points sit. And then the next thing you do is you go and look down that meridian. So if you say, for example, it's a large intestine, you look down that large intestine meridian, you look at the prominent acupuncture points along that meridian, and you go, right, are there any acupuncture points along this meridian that seem to treat this problem that they've got? And if they do, fantastic, whack them in. And then finally, you're always going to put a distal point in, right? So you're going to put a point in the hand that relates to the symptoms. If it was an anterior shoulder problem, it'd probably be like a lung 7 or a large intestine 4. So that's one way of doing it. So the plus sides to that, you're putting needles local to the area of the problem. The patient is like, yep, this is what I'm coming for. You're putting the needles where I need it to be. It's much like, it's a big likelihood it's going to have a big impact on that dorsal horn and that area that's creating the pain. Fantastic. I guess the downside to that can be that's the area that you might want to do some manual therapy to or some exercise-based therapy. So if you've got needles in the area, it really restricts you from what you're able to do. So there's one thing you can do. You can do the opposite side. So you can needle the opposite side, get that Dai Chi flowing, leave those needles in long enough for you then to be able to get some pain relief. It affects the other side, leaves this side free for you to be able to do the manual stuff and to be able to do the exercise-based stuff. So that's one option. All right, so real quick here, guys. What we're trying to do here is we're trying to provide high quality education through our podcast material, but we've developed something more. What we recognize is that clinicians are out there, they want to do acupuncture and dry needling, they want to do it more, they want to offer more. They know that acupuncture and dry needling has a fantastic evidence base, and in fact, everything's pointing to that we should be doing more acupuncture and dry needling. We should be using this with almost every single client that comes in, but people just don't know where to get started. They're feeling a little bit, oh, is it safe? Am I doing the right thing? So we have a membership for you. In our 3-tiered membership, what we can do is not only support your day-to-day practice, but we can push you on to become the go-to clinician in your area and perhaps nationally. And if you stay around long enough, maybe it's on the international stage. So let me just talk through what you get on every level. On every tier, you get the register. The register allows you to signpost your clients back to it to say, hey, I'm a reputable source. I've been trained properly. I haven't just kind of watched a couple of YouTube videos. I've done a proper training course. And it's also recognized by insurance providers. So if you want to claim back on the insurance, you can do that because you're a member of our register. The only way you get a member of our register is become a member with Breeze Academy. You get your safety course. The safety course is not just a few PowerPoints. It's in-depth video demonstrations on how you needle in safety across the whole torso, how you deal with adverse events, what the contraindications are to acupuncture. It's a world first. You also get access to our private Facebook group, and you get the clinical companion. And the clinical companion is basically like having one of our expert tutors in your back pocket at all times. So if you've got a client coming into you 5-10 minutes time, all right, they've got medial knee pain, get onto the clinical companion, upload the video. It's like 3 minutes, tells you exactly what you need to do, how you put the needles in, job's done. And we've got that for every single musculoskeletal complaint you can think of. So you get that. Now you get that all 3 tiers. On the essential tier, which is our basic tier, that's your package. If you know that you want to do more, right? If you're kind of the mindset that, you know what is, I want to offer more and I want to become the go-to clinician, then you've got the professional and you've got the growth tiers. A professional tier, what you get on top of those things is you get our monthly masterclasses. And our monthly masterclasses are us talking through a concept in loads of detail. So for example, each meridian is going to be mapped out. So we will show you how you find each acupuncture point on a meridian. We will show you how to needle every acupuncture point on the meridian. And then we go into the weeds. We start telling you exactly what every single acupuncture point does. On top of that, you get a free CPD course, so a specialist training course that you can either come to see us here at HQ, or we will be running sessions every now and then throughout the UK and beyond. And that can be something like, you know, pelvic health, or it could be like headaches, or it could be sport. So you get that in with the professional tier. Now, in with the growth tier, you get all of that, but you also get more of us. And in that, you get quarterly mentorship. And those quarterly mentorship is where you bring your case studies in. So you bring in people who you're seeing right now, people that you're a bit stuck with, you're not sure what to do with. It may be about how we develop and push your business and practice on. But in effect, what we're dealing with in the growth tier is we're dealing with people who want to be the go-to clinician. They want to be an expert in the field. And that's how we can do it through the growth membership. If you've done our entry-level acupuncture course, we have a separate tier for you completely. And in that separate tier, what we're doing is all of those things that I've listed, but it's tailored specifically to you guys that have done the entry-level course. The 3-tier scenario is those of you that have done the foundation acupuncture and dry needling, and the single tier is for those of you that have done the entry-level course. We'll pop the links below so you can see them both. If you've got any questions, you can just give us a call and we can chat through, or you just sign up now and get access. Your second option could be something dead simple like 4 gates. So 4 gates, large intestine 4 bilaterally, liver 3 bilaterally. And if you just kind of did that with everybody that came in, there's not a lot of thinking that you have to do, right? It's like, right, that in itself is a standalone intervention. And a lot of the Chinese medicine texts, they talk about this as like a big kind of treatment approach. And so it's really simple to kind of apply, and actually it covers lots of bases. I'd be particularly interested in doing something like that if somebody had a lot of stuff going on, particularly persistent pains and the chronic pains. But you know, when people have more than one ailment and there's maybe a psychosocial element to it, I think 4 gates would be a really good starter. And I guess you could do it one of 2 ways, right? You could do your 4 gates to get started and then do your other interventions, or, which I'm probably more prone to thinking about, is actually to do it afterwards. Because the 4 gates is something that really relaxes and chills people out. So if you're doing something that's fairly intense, let's say an exercise-based therapy or a manual-based therapy, that can be a bit sore, it can put people through the ringer. And maybe it's just doing that 4 gates afterwards just helps to calm things down a little bit. It's quite nice. So probably people are more likely to come back as well, right? So if we're thinking about, I guess, the pragmatics of making this work, if we're making people feel nice, we're getting that oxytocin, that serotonin released, we're probably more likely to get people to come back and say, hey, do you know what? That was a great session. I really enjoyed it. Remember, these needles are like 4 or 5 pence. So it's not as if you're losing a lot of money. It's like 20 pence in total for a 4 gates therapy. I think the other one is, another one that I always talk about is the auricular stuff. So doing your NADA protocol, the 5 points in the ear. If you're doing that regular enough, you can bang them in within a minute, right? If you're not versed on this, if you're kind of a bit apprehensive about it, you can buy like a fake ear. So if you buy a fake ear, you can start just sticking needles into it, right? And just practice the NADA protocol. When it comes to somebody coming into the clinic, you can stick those needles in. What's lovely about the NADA protocol is like it's that parasympathetic chilling out kind of treatment. So it helps to chill things right down, and that'll allow you to do your other interventions. So I guess for me, that is my kind of big thought at the minute, is like getting people to think about not acupuncture as an adjunct, not thinking of acupuncture as I'll do that if other things don't work. Let's think this is first line. We've got the evidence base. We've got some big randomized controlled trials. We've got big systematic reviews. We've got loads and loads of patient data to say, there's like over 4 million people that are going for acupuncture sessions every year in the UK. That's probably way more than that nowadays. That study was done in 2012, right? So there's loads of people looking for it, asking for it. If they're looking for it and asking for it, that's telling us something, right? That's telling us that it's making a difference to people. So what if we were to flip that model on its head and we were to go, do you know what? Let's acupuncture everybody that came to the clinic, presuming that, contraindications and precautions are all cleared. And let's see what differences we can make. A couple of other little bits I'd always add in there as well, in terms of making sure you try to maximize your effect. 1, needle acupuncture points. You're not just needling points anywhere in the dermatome or mytome or just somewhere in the vicinity. If you want to do that, you'll get okay results some of the time. If you want to get really good results, you look for acupuncture points and you needle that acupuncture point, all right? By far and away the most effective way of doing acupuncture, and you need to get that Tai Chi response, okay? So I'm talking about you guys who have been needling for a while. You've probably fell into bad habits. Don't just stick your needles in and leave them be. You need to look for that Tai Chi response. You get the Tai Chi response, you're much more likely to get those bigger reactions in the brain, those neuropeptides, the serotonins, the oxytocins, the endogenous opioids. You're much more likely to get all of that kind of stuff going. That's the stuff that really makes a difference. So be location of your needle size, all right? Look in your manuals. When you're on the clinical companion, we talk about the depths and stuff. So if you've got an acupuncture point that goes up to 1 sun in depth, you're using a 25 mil needle. If you're going for an acupuncture point that's 1.5 to 2 sun in depth, you're going for your 40 mil needle. And then if you're going for something like in the ass, you need to use a Salancelot. All right. So get your needle size right. Don't fall into the bad habits, or get yourself out of the bad habits of choosing like the small needles every single time. All right. So that would be my kind of final bits of take-home stuff. The things where I see people maybe tripping up are they're not using acupuncture enough and frequent enough. They're not looking for acupuncture points and they're just sticking needles in anywhere. They're not looking for Tai Chi, and they're not using big enough needles. Some quick fire tips there, guys. Love to hear how you get on and see if that helps to make a difference. I'll see you soon.